so you can simulate the fluid path and by calculation kind of see where those critical areas are, where you want to maybe make the design a little bit more rounded so that there is no kind of holdup of particular fluids.
Let's go!
Hey Joris, we're talking about drug delivery systems, and I'm wondering if we can talk a little bit today about some of the most challenging design considerations.
So, it's a good question, Nick. One of the features that always comes back is shearing. Shearing is particularly a problem when we speak about cell and gene therapy products.
And maybe I'll just stop you right there. Just for our audience, what is shear in your mind?
Yeah, shearing. So it's a particular problem for these larger molecules because shear is basically the pressure and a force that actually disrupts that molecule. So it makes it inactive. It generally renders it inactive. We see a lot of proteins clustering together after shearing, and they become inactive, and therefore, in a drug delivery device, it's something you typically want to avoid.
Right.
So, when we speak about shearing, what causes shearing? Well, it's generally a fluid path, and fluid moves through that path. That's generally done in a drug delivery device. Mm-hmm. And if there's abrupt changes in that fluid path, and the fluid starts to move in a kind of an uncontrolled fashion, then that's where you see shearing. Another reason for shearing would be bubbles in the fluid path, because it's a very uncontrolled mechanism. Or when a pump is actuated, and a pump can actually cause a lot of friction on the cells or on the biomolecules that are in that fluid path. So all those features are things you want to kind of avoid, or at least control and understand in your design. So typical things that you can do is, first of all, design a fluid path that doesn't have those kind of abrupt changes.
Sure.
And you can kind of address that by simulation in the design process. So you can simulate the fluid path and by calculation kind of see where those critical areas are, where you want to maybe make the design a little bit more rounded so that there is no kind of holdup of particular fluids. You can also choose pumps that are designed to be low shear, and all of those things can eventually end up driving a drug delivery device that gets most of those active molecules in active form into the patient to where they need to go.
Right, getting the right active drug in the right place.
Exactly, yeah. And then once you've done with the design, how do you then test that? Well, first of all, you kind of simulate that, but in the end,
CFD or computational fluid dynamics.
Exactly, that's exactly that. And you also want to do functional testing. So what goes in also comes out. So if your cells go in, you can look at viability at the end of it all, or you can look at if your antibodies are still intact or your viruses are still active and can infect cells.
Very good. Yeah, too much shear and they break apart and then they're not alive anymore.
Yeah,
makes sense. Cool. Great. Well, thanks very much for that.
Thanks, Nick.
Have a great day.